Mr. Speaker, on Tuesday, the Congressional Budget Office, headed by Mr. Elmendorf, who's the director, told Senator Baucus that his plan to cut $123 billion from the Medicare Advantage, the program that gives almost one-fourth of seniors private health insurance options, will result in lower benefits and some 2.7 million people losing their coverage. Well, last week, Mr. Baucus ordered the Medicare regulators to investigate and likely punish Humana, Incorporated, for trying to educate enrollees in its Advantage plans about precisely this fact. Well, Jonathan Bloom, who's the acting director of a regulatory office in the Centers for Medicare and Medicaid Services, who used to work for Senator Baucus, said that a mailer Humana sent to its customers was, quote, misleading and confusing to beneficiaries who may believe that it represents official communication about the Medicare Advantage program, end quote. Mr. Bloom has also banned all Advantage contractors from telling their customers what Mr. Elmendorf has told Congress. Mr. Bloom, as I said, happens to be a former senior aide to Mr. Baucus and a health advisor on the President Obama transition team. So, for the record, CBO's Director Elmendorf says that cuts to Medicare Advantage, quote, could lead to many plans to limit the benefits that they offer, raise their premiums, or withdraw from the program. But they want to put a gag on the deliverers of this coverage because they're writing to their patients, to the people that they're covering, and telling them that they're going to lose coverage if this bill passes, that Medicare Advantage is going to be gutted. Senator Baucus is now saying we want to put a gag in the mouths of the people who are providing this coverage so that they can't tell the senior citizens of this country they're going to lose Medicare Advantage coverage. That is a violation of the First Amendment. And secondly, I don't know of any rule that would allow Senator Baucus to do this. This is absolutely a terrible thing. And Mr. Bloom doesn't have the authority to do this. Mr. Baucus, Senator Baucus, does not have the authority to do this. And yet they're gagging the health care providers, the people that are insuring these people and providing the coverage, by saying you can't tell them that they're going to lose Medicare Advantage. The plan, Mr. Baucus, and other plans here in the House and the Senate are going to cut $500 billion out of Medicare. And most of it's coming out of Medicare Advantage. And they're trying to keep the seniors in this country from knowing it until they get the job done. That is criminal. First, they violate the First Amendment rights of these companies. And second, they gag them and threaten them with criminal prosecution or some kind of penalties if they don't adhere to what Mr. Baucus says or what Mr. Bloom says. And then they don't let the American people, the seniors who vote more than anybody else, to know they're going to lose Medicare Advantage and they're going to take $500 billion out of Medicare coverage. Seniors need to know this, and yet they're gagging the people who are trying to get the facts out. This is just dead wrong. It should not happen. This is government control in its worst form, and it's something that we should not tolerate. In addition to what I just said, I want to read into the record a letter I got from a Dr. Ned Mossbaum, who's a forensic psychologist, a forensic psychiatry expert in Indianapolis, and he wrote this to the American Medical Association. He said, Dear Congressman Burton, he wrote this to me about the Medical Association. Dear Congressman Burton, thank you for your very well thought out letter. When I heard about the new AMA position supporting socialized medicine, and folks, that's what it is, I felt sickening, a sickening feeling in the pit of my stomach. I've been a member of the AMA for over 40 years. Unfortunately, it has gradually become a leftist political cheerleader with the usual pro-abortion and anti-Second Amendment dribble. However, this illiterate position for socialized medicine betrays its own members and the American citizenry. It is so blindsided that it also eliminates the need for the very existence of the American Medical Association. If we all become serfs for the government, we no longer need a formally scientific professional organization. With the AMA headquarters in Chicago, the AMA president and his ilk must have been polluted with Chicago-style politics, and their brains have turned to mush. This morning I had a lengthy teleconference concerning the issue with the Executive Vice President of the Indiana State Medical Association, Mr. James G. McGuire, J.D. Apparently, the Indiana State Medical Association has not yet taken any position. I have also written a letter to the President of the AMA, a copy of which is enclosed, advising my position and the intent to resign as a member. Please keep up the good fight. This is the kind of information that needs to get out to the Americans. Seniors need to know they're going to lose coverage, and $500 billion is going to be cut out of Medicare. Thank you, Mr. Speaker.
Gentleman from Colorado is recognized for 1 minute.